So, hi, Marianne. How are you?
Hi, Christy. How are you?
I'm great, thank you. And I'm so happy to have you here today to share more with us about the Maternity Care Coalition. So, can you start by telling us a little bit about yourself and what led you to your current position as the president and CEO of the Maternity Care Coalition?
Well, I thought a lot about this question, Christy, and I'm grateful that you have both invited me to come and talk with you. I'm excited by the opportunity. And I thought a lot about this question, and I just really want to ground it in who I am, which I think is as important as the decisions that I made. It's who I am, and how I got to MCC is I was born into a life of service. If I really think about it, I was born into it. My parents were both immigrants to the United States from Jamaica, and they were missionaries. So that may sound a little interesting or different because many times missionaries leave the U.S. and go to other countries. But my parents, many, many years ago, decided that they wanted a life of service building Bible clubs in the U.S. So they came, and I have 5 siblings, and I'm the sixth, I'm the youngest, and we were all born in different states in the U.S. So, how my mother did that, 6 kids in 7 years, I have no idea.
Wow.
But I was born in Des Moines, Iowa, and then my parents took on a missionary assignment in Philadelphia, and so I have no recollection of Iowa, but I grew up in Philadelphia, North Philadelphia, and they ran a rescue mission, which is still located at 6th and Spring Garden, or 6th and Green, and that was where I spent my entire childhood. And we had meetings like 4 times a week where we were serving those experiencing homelessness, and we prepared meals, we gave out clothes. So when I say I was born into a life of service, that's what I mean.
Yeah, it's been with you all the while, just sort of a part of your fabric, if you will. I think that's amazing that you've come to the position that you're in now by way of this sort of life of an intention on service.
Yeah. But I do want to add one kind of nuance that I think will make it more meaningful because it was a full circle moment when I started at MCC back in, I guess it's 2017 now. But my parents being missionaries, and any time you know anyone who's like a PK, preacher's kid or pastor's kid or missionary kid, there is this expectation that, oh, they're standard, they must be really like holier than thou. And it's the exact opposite. So I really went through a period of rebellion because it was just like, I am really tired of being perceived of as the goody two shoes, and my parents are this. And I also want to set the timing because in the 60s, so I'm dating myself, the area where the mission was located, gang wars, it was really a pretty depressed community, and we were serving primarily Black and brown families, and so it was not the most pleasant place. And so well, I should say it like this: it's not that it was about pleasant or unpleasant; it was really about the economics. And my parents kind of sent me away to a boarding school so that I could get, once I got to high school, a better education, which was a whole nother story. But I had a teenage pregnancy, and it was not well received by my family. So I really had to make some really tough decisions around how I was going to shatter stereotypes because I never wanted to be an unwed teenage, person. And here I was, my parents pretty much disowned me. And so I would say that that period of time was incredibly instructional. Okay, it was painful. And that pregnancy resulted in a stillbirth. And the situation surrounding it was just, when I look back on it, it was very, very painful. And I would say that the way in which I experienced it in the medical setting, socially, is why I say it's a full circle moment that I was able to now lead an organization that serves so many birthing people that looked just like me and had experiences similar to myself. And so I think it was providence that I came to MCC, and my whole heart is to serve and ensure that no other person had to go through what I went through. So.
I'm so sorry that you had to go through that. And it's interesting how those most painful moments in our life sometimes end up being the catalyst for our ability to really help other people who are in that same situation. And it's beautiful, really, in that sense, that that's exactly where you are and what you're doing right now. And that it's not like it sort of relates, it's the exact same scenario, exactly what you're talking about. So thank you for being willing to share that with us, because I do think that that really helps us better understand where your passion lies for this, the community that you serve and the work that you do. And there's just so much more meaning, too, behind you as the leader of this organization. So let's talk a little bit about what Maternity Care Coalition is. So in 1980, a group of Philadelphia health and social justice activists came together over concerns about the well-being of pregnant people and infants. Can you tell us more about how they created the Maternity Care Coalition and what were their initial goals in those early stages of the organization?
So I've heard about that. Obviously, I wasn't there at the time, but those activists included a lot of different organizations that are committed and continue to commit to working collaboratively to address what was really appalling rates of infant mortality. That was what drew them together and create this coalition, because there were such appalling infant mortality rates, which, by the way, have improved, but the maternal mortality rates continue to skyrocket and maintain and are very high, particularly amongst Black birthing people. So that's kind of what the impetus was to create this coalition. I think that the who and the what is probably more important than how they did it. It was a group of diverse leaders that really recognized that together they could do much more than separately. And that's a tenet that I continue to strongly believe in. Why Maternity Care Coalition continues to exist and have impact after 40 plus years is because we bring together people who are committed, the coalition of the willing, those that are willing to say, I'm not going to stand for that, and to recognize there is a better way if we work together. So I think that those activists, I am often in awe to think that I'm standing on the shoulders of people who founded such an important organization that, had I known back then, could have helped me when I was going through my issues. But I'm so glad that we're here and that they had the vision to create and coalesce around something meaningful, like making sure that we can reduce the inequities that result in births that, just unnecessary deaths. And a lot of the data does suggest, not just suggest, but points to, if we do things, if we listen to birthing people, we listen to what they're saying, we can begin to reverse some of the trends that have been so horrific.
Absolutely horrific. And it's beautiful also to hear you talk about, standing on the shoulders of these activists, because anybody who sets out with an intention to help a community, especially a marginalized community, or people who just don't have access to the right care, when they set out with that mission, it's like, you can only know that what you're doing is hopefully making a difference, but your greatest hope is that your mission will go on beyond you. And so to know that the Maternity Care Coalition has now become what it's become and is continuing to make such a significant impact, I'm sure you're making them very proud.
I hope so.
I think so. So today, children and families are truly at the center of what MCC focuses on. You're a coalition, like you said, of activists, which is where it started, educators, care providers, and researchers working to improve the health and well-being of pregnant people, babies, and their families. So can you tell us more about the services that you offer now and the programs that you have in place to help achieve these goals?
Certainly. When I took over from our founder back in 2018, our mission is very clear: to help improve the well-being, you mentioned it in your question, of pregnant people, and to make sure that the kids can families could thrive. I remember thinking, this is great, but how do we know that we've made an impact? What's the metric that we're going to be able to point to say we have achieved this mission? And so we embarked upon something called our theory of change, which is a very technical sounding term that a lot of nonprofits use. And essentially, it's your North Star to define and guide towards the intended impact. So the reason why I'm answering your question, what seems like in a roundabout way, is because I'm really proud of the theory of change that the team, our entire organization, we got representation across the organization, stakeholder groups, to really clarify what our services were doing, who we were serving, why we were doing it. And this builds on the work that our founders, those activists, did. So today, we're very clear. We didn't say it before, that we are about reducing disparities in Black and brown communities. That was sort of a byproduct of a lot of the things that were done before, but we were explicit about who we're serving, not to exclude anyone, but to ensure that if we can lift up those that are most marginalized, everyone else will be benefited. So we got really clear about who we're serving. So we're serving mostly marginalized communities, Black and brown, because that's where the data says we have the greatest disparities. We have 5 focal areas. We service families or parents. We service communities. So it's not just we're kind of going in a concentric circle out. We work on policy issues, because you can help one person, you can help a community, but unless we can make systems level change at the legislative level or policy, which is really where we started as an organization, that's how we're going to really reach that intended impact. So that's the approach. We've got very clear and specific. We have focal areas around parents, communities, policy. We have over 20 programs that leverage what we call home visiting as a model for help for working with our families. So we go into folks' homes, families' homes, and provide health education, making sure that they have the resources to be able to advocate for themselves. We work with partners throughout the community. That's at the community level. And then policy, we are a leader statewide in maternal and infant health issues. So that's kind of how we're structured, and that grew out of that work that we did to clarify our services. And now we're in 8 Pennsylvania counties.
Wow.
And the state of Delaware. And the state of Delaware is kind of unique. Our founders established a program back in the 80s where we were providing prenatal care and support to birthing people that were incarcerated in the Philadelphia correctional system. Because of the work that we did there, we were invited to provide that similar service in the state of Delaware, which is smaller, so it's the entire state that we're serving, their correctional system. And I think we're really, we really would not want any pregnant person to be incarcerated, because that sets this system up for you. The baby doesn't have the ability to, the birthing person can't bond with the baby because they're immediately separated after birth. Can you imagine being, we can stand in judgment and say, well, that person, broke the law and so they shouldn't have X, Y, and Z. But when you're a parent and you immediately separate a child, a baby, from his or her mom, that sets that child and that relationship up for an intergenerational cycle of trauma. So, we're really proud about that particular program. But those are the types of things that MCC is doing today. We're now into a lot of mental health programs. We bring therapy into our families' homes. And because our signature program was called Mommobile, because our founders, they developed a program where the cars were going around the city. They were wrapped with our brand. And so families would know, oh, there's the Mommobile. And so we've used that branding to kind of associate a lot of our programs. So we have a Mommobile, mobile therapy. We have a Mommobile Healthy Start. We have all these different programs that we've just branded with Mommobile. It's all about bringing services to our families and to the community.
Wonderful. It's just such incredible work that you're doing, and I'm so happy to hear that it's expanding.
Yeah.
And that you're, especially to your point about the incarcerated individuals, and where we could possibly have judgment on the individual who's incarcerated, the baby. It's like, can you think about the baby? And that, and no matter what the reason is that the person is incarcerated, having that level of compassion and understanding for the fact that this is life, right? This is an individual's life and their child's life. I just think it's amazing that you are meeting that need. And I love to hear all of these programs that you have in place. And this sort of speaks a little bit to what you were just talking about how Black and brown families in the United States often face inequitable systems, right? And right now you're saying, you're really being very specific about this is the goal, this is who we serve. By focusing on reducing disparities for families who are marginalized, the Maternity Care Coalition is advancing equity and quality for all. So can you tell us a little bit more about how you're specifically focusing on that?
Yeah. In a word, we're starting inward. We, as a agency, strongly believe that we cannot, nor should we, advance any equitable diversity, equity, inclusion, justice practices unless we start with ourselves. So we put into place right after, we've been kind of grounded in those DEIJ, diversity, equity, inclusion, and justice practices well before, I came on the scene. But what we did do, again, similar to that theory of change, is we established a agency-wide task force and built our plan, especially after George Floyd's murder, and we articulated in writing what we were going to do as an organization around DEIJ, because we felt if we don't start with ourselves, because bias shows up everywhere, right? Then how in the world are we going to be able to really affect change elsewhere? So we started with ourselves. We hold ourselves accountable to that plan from the board all the way down to, the frontline employees, everyone. We hold ourselves accountable to what it means to be equitable and promote justice. And we have monthly meetings that are we have courageous conversations. And what that does is it allows for a frame of reference for our home visitors, for all of our staff to interact with our families. And that's the way you kind of incrementally and hopefully in a more disruptive way, not disrupt, but you disrupt those processes that are so entrenched. You have to start somewhere. So we start with ourselves. So that's how I want to kind of frame our work. And then we also are looking at how do we, you give someone what do you say? If you feed someone a fish, that's one thing. But if you teach to fish, that creates the sustainability. So we really are committed to workforce development in our lane. We're very clear about what our lane is. And that is we serve families with children that are from the ages of 0 to 3. And within that, there's a big push for birth workers. So we have a shortage of, doctors or medical providers that look like the folks that we serve. So how can we build the pipeline? Well, we have a very well-respected program called Perinatal Community Health Worker Training that we actually have gotten, credentialed for, not credentialed, but the state has recognized this program. It's a 27-week intense program that then creates a curriculum that helps embeds the DEIJ practices into birth work, and we train community members to be doulas and lactation specialists. So they're working in their communities. They've gotten out, and we pay them a stipend so that it's a bit of a workforce development, and it's creating a pipeline of birth workers who now are going on. Some of them go to become midwives, go to become nurses. So we're building internal capability in the communities for a desperately needed service. I would have loved to have had a doula. I didn't even know what a doula was. Did you have a doula?
No, I was going to say, I mean, I think I knew what a doula was. I don't think I appreciated how much I could have benefited from it. And I too wish I had one as well. And I love the fact that you're talking about bringing people who are already a part of this community into that type of program, right? Because also to your point that you were saying earlier, when somebody's birthing, to have someone from your community who either looks like you or, just understands you better, that is what I think would have done me well with a doula is, I remember actually having my oldest son that I had many great nurses throughout my process, but I had one that was a little tough with me. And I just remember thinking, like, I need somebody that gets me right now, that can show up in this compassionate way. Yeah. I was trying to do like yoga breaths and all this kind of stuff. Like, I was very into yoga at the time. I still am, and meditation. And so I was trying to get myself into that space, and she was not having it. She was very old school. But, I not to throw her under the bus, but it's just that I think I can see really the value when you take that type of concept and you look at people who have been in marginalized or who are in marginalized communities and have never been met with that type of compassion and to have somebody next to you that's like, I see you, I understand this, I'm here for you. That's invaluable and so incredible that you could offer that to people within the community and then empower people within the community to offer that to somebody else.
Exactly.
Like, what an amazing, incredible community building program that is. And it sounds too like much of what you're doing could be a blueprint for many other cities to take on and many other communities to take on, to start with this approach, like you said, where it starts with us and then how can we build this ripple effect throughout the community?
Yeah, and I appreciate your acknowledgement of how wonderful this is, because it is affirming. But I don't in any way want to imply that MCC is the only organization doing things like that. I think we're really unique because of the strength of our training. We want to be the best we are for the folks that are in our sphere, and we want to partner with organizations that are coming up. There are so many opportunities to fix this problem if we stop being siloed, if we stop looking at things like, this is MCC's, slice of the pie. It shouldn't be about that. What does our community need? Who's proximate to that person or the needs? And then how do we work together to really amplify each other's services, messages, and fix this once and for all and stop fighting over. It's really, that's one thing about the nonprofit world that, like, I have a background, I've done so many different things. I've been blessed with lots of different opportunities. But one thing I find is if you don't work together and if you don't build bridges, you're going nowhere. And really, we're here to serve and to make a difference. Like, we should be wanting to eliminate our organizations. Like, when I think of this discussion we had before we got on air, and you shared your personal story, which I really appreciate. And I'm just, my heart was touched about, like, your mom. It really, you want a cure. There, you don't want to keep on.
No.
The goal of your nonprofit is to work together, is to find a cure, because we don't want anybody to go through this pain or this trauma.
Absolutely. And actually, everything you just said, I 100% relate to with the nonprofit world. And that's been a battle for me as well, is just also trying to get organizations to understand that we should be working together so that this patient community can see that we're all working for the same common goal, right? And that, exactly as you said, we're really only going to make the greatest possible impact if we work together.
That's
If everybody's in their own lane or sometimes side by side doing the exact same thing but not collaborating with each other, we're stunting our growth. We're stunting the impact that we can all ultimately make if we did it together.
and patients are waiting.
And people are waiting,
They're
yes.
waiting for us to do this right
Yes.
and to care about something other than what's my operating budget.
Yes, absolutely. And I think I found too, it's always about like grounding yourself in that, reminding yourself of that as organizations, that what are we here for?
Right.
Why did we create this?
Mm-hmm.
And what are we here trying to, what solutions are we trying to find? And that actually leads me to my next question, because you talk about advocacy efforts and how that serves a vital role in supporting the families that you work with. What type of advocacy does MCC do?
Well, we advocate at the local, community, local, and state level, and we have a really strong advocacy department. Right now, it's small, but it's mighty. And what we do is we really look at, we were kind of bringing together, we're parts of coalitions. So, for example, we have our leader in the advocacy space leading the perinatal work for a campaign that's statewide called Thriving PA. And we are leading that perinatal work. And one of the wins of that state level advocacy is that we were able, along with our partners, to extend Medicaid coverage for pregnant people beyond to a full year. Can you imagine, like, if you have 3 kids, like, and you had to go back to work, like, after 2 weeks, after 60 days or whatever, and you're giving birth and your coverage is from Medicaid, and that's all you get. Yeah. So our team not our team, like I said, the coalition worked on that we're leading, that worked on to get it extended to a full year, and that was a huge win. That's the kind of stuff that we're doing. We are currently adding to our policy agenda to include economic security, because 1 in 5 families in Philadelphia lives below the poverty level. We know that I know that we get tired of hearing that Philadelphia is the poorest, biggest city in the U.S., and it's not something that we should be proud of and we should be really concerned about. But we understand that families, from the very beginning, if we don't focus on advocating for something practical like paid medical leave, paid family leave, we don't currently have it. So many families cannot afford to take time off because there's no opportunity for them to have any coverage. That's a serious problem. So we're advocating for that. Anything that's focused on caring for birthing people, perinatal depression, anything that we can advocate on the state and local level, that's where we are. You'll find MCC staff, and we're there just trying to make sure that our legislators understand the impact. That's the only way we're going to break this cycle of intergenerational poverty, is if we equip our families with the right resources, and private and government resources can make all the difference.
Absolutely. It's just so wonderful that you're taking so many different approaches to this and tackling all of these different aspects of the problems that the community that you serve are facing. And I wanted to talk to you about the topic of compassion, because we talk a lot about that on this podcast. Mm-hmm. Compassion and community are 2 main threads throughout these conversations, and I really just love to hear everybody's different take on these 2 words. So can you tell us first what your own definition of compassion is and how it relates to the work that you do?
Sure. So I'll tell you what it is not before I tell you what it is.
Yeah, there you go.
It is not charity. Compassion as a definition has to do with some kind of response and action. So I tried to think of how to respond, but I feel like I just have to be personal, right? And compassion And why I said it's not so, there were churches that used to come to the mission when I was growing up, and they were so compassionate. They wanted to help the poor people, and their heart was really, I'm sure their heart was in the right place, but it didn't meet the needs always because there was this barrier, because there was a lot of judgment that was going on. And I fall prey to it too. Like, if you're being compassionate, you're not casting aspersions, you're not judging, you're there motivated by some, I'm going to use this, it's a heavy word, love for that other person. It's grounded in otherness, like they're centered. And like I said, when I was growing up, it really bothered me when some of the suburban folks would come into the city and they were going to help these poor Black people. And I just was like, really? So I try to check myself. When I'm being compassionate, is it about me or is it about them?
That's what I was thinking, exactly what I was thinking as you were saying that, is that it begs you to ask the question, like, are you here for me? Are you really here for us? Or are you here because it's going to make you feel better that you're here? And I love that take on compassion, because it requires you to dig a little deeper and do a little bit more self-reflection as to how can I show up compassionately in a very authentic way.
Right.
And show true compassion. And what does compassion mean, right? It makes you think about, is it just showing up and doing something so you can pat yourself on the back to say, I did something good today? Or is it digging deeper and finding new ways to show up for other people?
I love that, Christy. Finding new ways.
New ways to show up for other people. And, I think I say that because I've learned it myself, that I'm always trying to challenge myself to find new ways to show up for other people and show compassion. And it requires you to do a little work.
It does.
On yourself, or a lot of work. But it requires work. And but I think the value, the takeaway of that is that when you really do show up in a genuine way, the reward you feel for that far outweighs the reward that you would feel if you just showed up to do some good and you want to turn around and go home and say, I did something good,
Yeah.
It's about that. Authenticity is a big part of it as well. So thank you for sharing that. I love that conversation we just had about compassion, one of my favorite topics. And community is also something we often like to talk about here on the podcast. So how important is the aspect of community, would you say, for the families that you serve?
Well, I would say it's essential. That feels inadequate. Why don't I explain it by how we approach work. We approach our work in a radically family-centric way. So we have like a graph that shows like a mom or birthing person, baby, dyad in the center, and then all of our services around. So community is one of the stakeholder groups. I mean, a collection or group of birthing people and babies comprises a family, a community. But what we do is we center them. So how important is it? It's the reason why we do what we do. But it's how we do it that's most important. So when one of our home visitors goes on an initial visit to a person's home, what they want to do is identify their birth goals, their goals, which may not be like, oh, I want to have, I don't want a C-section, or I don't want this. They'll be, something, I just want to get my GED, or I want to be able to reunite with my partner, some kind of goal that they define. That becomes part of our plan of service with them. And so communities are the same way. What does the community need? And so here's an example. We recently got an award in 2021 for a program called Manco Mamas, which was based upon a research project that was done the year before. I think it started in like 2018, where there were a group of researchers that went into Montgomery County, which is, has a lot of wealth, but then there are pockets of great need, communities with great need, to understand why were there such poor infant mortality rates. And so this group did a lot of research, engaged the community in understanding what was going on, came up with a set of data. It was called perinatal periods of risk, under kind of outlining all of the things that they learned in that period of time. And then what we did was we handed it over to the community and said, now what should we do with this?
Wow.
And MCC led that work and continues to. And now we're replicating that program in other geographies.
Wow.
So when you ask how important is the community, that program, and it is a model of how we do work. It's not us being some saviors to come in and we have all the answers. The answers are in the community. The answer is, what can we do to partner with you, community member, to achieve what you feel is going to make a difference? Imagine if we flip things that way and actually, instead of being the brilliant people that we think we are, we're going to come in and we have all the solutions. We don't even know if the solutions we have are what the community needs. So let's flip it. Let's deprioritize and decenter ourselves, center our communities. Really, I mean, I don't mean in word, but I mean in deed. And that program, Uncle Mamas, is a great example. And if anyone wants to learn more about it, just go on our website. We highlight it because we're really proud of that particular approach, because that's what it is.
And you should be, because that's powerful. And I think that as I hear it, I'm thinking, and won't that make it more sustainable long term?
Absolutely. Because what we're doing is we're getting ourselves out of the way and partnering with the community to build internal capability, if you will. And it's a lot of words, and it's not easy, because I'm here to tell you, it causes me to step back sometimes. So I'm like, oh, I'm the CEO. You know something? I don't have all the answers. And if I'm not surrounded by people that know that they can safely challenge the perspectives that I might share, or it's the same way, I have to check myself. When we go to communities, it's easy to say, we're going to convene we're going to get your point of view, but we need to give power away. So, for example, on our board, which is supposedly the top governing entity in an organization, we absolutely have what we call lived experience experts serving on our board. That's the way the Manco Mamas, we have a community advisory committee. All of our programs include members from the community that are driving the decision making, so that the power isn't totally on us. And easier said than done.
I'm sure. I was going to say it's super empowering is what you're doing for these communities, empowering them to make choices and decisions that ultimately are going to benefit their community. And you're there to be a support system to kind of hold them up while they figure that out, or, while the plans are put in place. But I would imagine it's probably really challenging.
Yeah, I mean,
to kind of just flip the script that way.
Yeah, and I think what we've learned, and what we are learning, especially with the Manco Mamas Steering Committee, is that sometimes we have the best intentions and we use all these terms. If there is a lived experience expert on this board or this committee, and they don't understand what we're talking about, then we failed. And if they don't feel comfortable enough to say, what are you talking about? And that's not going to benefit me. Who's that going to benefit? If we've not created the environment in which that type of tough dialogue can happen, we failed. So, my team will tell me all the time, Marianne, you use all those corporate terms, and because that's part of my background, and I appreciate it. I'm like, okay, I hear what you're saying. Let me try again.
That's a great example, I think, I have even found myself sometimes when I stepped into the nonprofit world that some people in the executive level would be saying things to me, and I'm like, I don't know what you're saying.
Right.
I don't know what you're talking about. But you're right. It's about creating the space and allowing people to say, like, it's okay to tell me, could you change the way you're saying that or explain that to me differently? Or I think it's so powerful what you and your organization are doing on the whole, but just to learn more in depth about all the intentions behind the work that you're doing and just how clearly you're thinking through every single program and every single act of service that you're putting into play. It's just so wonderful to hear about, and I really appreciate you taking the time to share all this with us today.
Well, I'm honored that you would even invite us. It makes a difference anytime that I can get to spend time with someone who's as brilliant as yourself, as committed to this, and just committed to making life better. Be good. I'm there. Anytime you need anything, I'm there. And I'm just always wanting to talk about MCC. I love the organization. I think the work that we do, like I said, I wish it had been there when I was, struggling, but I'm glad we're there for I guess we've served about over 150,000 families over the space of time that we've been in existence. And we probably serve about nearly 4,000 every year, and we're growing. We have programs that are going to take us now into like Berks and Northampton counties, and but we're being very thoughtful because it's not about growth for growth's sake. It's about where's the need and where is the special services that MCC has that can meet those needs. And if there are other folks in those communities that are doing it, how do we help them so that we can have more impact in those areas? So stay tuned.
Stay tuned. And that is what I was going to ask you to tell us next is how can listeners support the work of MCC? How can we follow along with everything you have going on? How can we tap into that? Where should we go?
Well, www.maternitycarecoalition.org. So www.maternitycarecoalition.org. And we've just refreshed our website. So kudos to my team that did that. It's amazing. And we also just published our 2023 annual report, which you can actually link to from the website.
Great. I'll be sure to put a link to that in the show notes too.
That'd be great.
So people can very easily access that. And I was just on the website recently and it does look fabulous.
Yeah.
And I can't thank you enough for taking the time to be here with us. I encourage all of my listeners to check out the website, see how you can get involved, see how you can support. And I'm just wishing you all the best as you continue to grow forward with this mission.
Thank you so much, Christy. I really appreciate it.